Alright, so this is the muscles of the leg and foot. First is the iliopsoas, is a composite of two closely related muscles whose fibers pass under the inguinal ligament to insert via a common tendon on the femur, which is made up of the ilius and the poso major.
So it's like found like right around here in the pelvic area. So then you have it's made up of it's made up of the iliacus and the psoas major. So the iliacus, its origin is the iliac fossa and crust, and the insertion is the lesser trochanter of the femur. And its action is its flexing of the thigh and flexing the trunk on the thigh. So as you can see in the book, and then you have your psoas major, which is the origin is the transverse processes, bodies, and discs of the lumbar vertebrae, and the insertion is the lesser trochanter of the femur, and its action is the flexing of the thigh, flexing of the trunk, flexes the vertebral column laterally, and as you can also see, okay. Next is the sartorius, which is right here. So it's 23, and it fits. It's in here. So that's the adductor magnus. It's the sartorius. The origin is the anterior superior iliac spine, and the insertion is the wings or around the medial aspect of the knee, the medial aspect of the proximal tibia. And its action is it flexes, abducts, and laterally rotates the thigh. So next we have the adductor magnus, which is 28. It's kind of hard to see. It's right here. Its origin is the ischial and pubic rami and ischial tuberosity. The insertion is the linea aspera and adductor tubercle of femur, and its action is it adducts and medially rotates and flexes the thigh and thigh extension. So next is the adductor longus. Which is right here. So the adductor longus, its origin is the pubis near the pubic symphysis, and its insertion is the linea aspera, and its action is it adducts, flexes, and medially rotates the thigh. Next you have your adductor brevis. Its origin is the body and inferior pubic ramus, and its insertion is the linea aspera above the adductor longus, and its action is it adducts, flexes, and medially rotates in the thigh.
So it'd be right here, the adductor brevis.
Okay, next is the pectineus, which is 26. So that's way up here. The origin is the pubis. The insertion is the lesser trochanter to the linea aspera on the femur, and its action is it adducts, flexes, and medially rotates the thigh. Next is the gracilis, which is 27. So that is in between 26 and back here. It's like the inside or the medial portion of your thigh. Its origin is the inferior ramus, body of the pubis, adjacent ischial ramus, and the insertion is the medial surface of the tibia, and its action is it adducts the thigh, flexes, and medially rotates the leg. So next we have our quadriceps femoris. Okay, so that is underneath 10. It's 16, so right here. So this consists of your rectus femoris, your vastus lateralis, your vastus medialis, and your vastus intermedius. So obviously this is just a small portion of it. So you have your rectus femoris, which is right here. It's 19. Its origin is the anterior inferior iliac spine. Its insertion is the patella and tibial tuberosity, and its action is it extends the leg and flexes the thigh at the hips. Next we have the vastus lateralis. Which is 20. Let me find it. Oh, it's right here. So next to 19. Its origin is the greater trochanter, the intertrochanteric line, and the linea aspera, and its insertion is the patella and tibial tuberosity, and its action is it extends the leg and stabilizes the knee. Next is the vastus medialis, which is 22. Should be right here. Its origin is the linea aspera, and the insertion is the patella and the tibial tuberosity. Its action is it extends the leg. Next we have the vastus intermedius. So that's 21, so it's right here. Its origin is the anterior and lateral surfaces of the proximal femur shaft. The insertion is the patella and tibial tuberosity, and its action is it extends the leg. Next is the tensor fasciolata, which is 17. Its origin is the anterior aspect of the iliac crest/spine, and the insertion is the iliotibial tract. Its action is it steadies the leg and trunk on the thigh by tightening the iliotibial tract. Next we have the gluteus maximus, which is right here. So right here. Its origin is the dorsal ilium, the sacrum, and coccyx, and the insertion is the gluteal tuberosity of the femur, and its action is its major extensor of the thigh. So next we have the gluteal medius, which is under 10. So right here, 11. Its origin is between the anterior and posterior gluteal lines on the ilium, and the insertion is the short tendon into the lateral aspect of the greater trochanter of femur, and its action is it abducts and medially rotates the thigh. Next is the gluteus minimus. The origin is between the anterior and inferior gluteal lines on the ilium, and the insertion is the anterior border of the greater trochanter of the femur, and its action is it abducts and medially rotates the thigh. So as you can see in the book,
Right there. Gluteus medius.
okay, so next is the piriformis, which is 12, so right here. Its origin is the anterolateral surface of the sacrum, and its insertion is the superior border of the greater trochanter of the femur, and the action is it rotates extended thigh laterally. Next is the obturator externus. The origin is the outer surfaces of the obturator membrane, the pubis, and the ischium. The insertion is the tendon into the trochanteric fossa, and the action is it rotates extended thigh laterally. So as you can see in the book.
Right there.
So next is the obturator internus, which is 14 here. Its origin is the inner surface of the obturator membrane, the greater sciatic notch, and the margins of the obturator foramen. The insertion is the greater trochanter in front of the peripheral morus. The action is it rotates extended thigh laterally. So next is the gemellus, which is 13 and 15. So we have 13 right here and 15 right here. The origin is the ischial spine and the ischial tuberosity, and the insertion is the greater trochanter of the femur, and the action is it rotates the extended thigh laterally. Next is the quadratus femoris, which is 16. So here. We already did that one, didn't we?
I don't think so.
I don't have that in here.
The gemellus.
The quadratus femoris.
So its origin is the ischial tuberosity, and its insertion is the interocranic crest of the femur, and its action is it rotates thigh laterally and stabilizes hip joint. And
it's right here. It's the same thing as the quadriceps femoris.
oh.
So then you have your hamstrings.
The hamstrings are fascially muscles of the posterior thigh and biceps, and they cross both the hip and knee joints and are prime movers of thigh extension and leg flexion.
Okay. So then next is the biceps femoris. 32. So right here. The origin is the ischial tuberosity, the linea aspera, the lateral suprachondrial line, and the distal femur. The insertion is the head of the fibula and lateral condyle of the tibia. The action is it extends the thigh and flexes the leg. Next is the semitendinosus, which is 30. Its origin is the ischial tuberosity, and the insertion is the medial aspect of the upper tibial shaft. And its action is it extends the thigh and flexes the leg. Next is the semimembranosus, which is 29, so right here. Its origin is the ischial tuberosity. The insertion is the medial condyle of the tibia, and the action is it extends the thigh and flexes the leg. So next we have the tibialis anterior, which is 33, so right here. The origin is the lateral condyle and upper 2/3 of the tibial shaft, and the insertion is the inferior surface of the medial cuneiform and first metatarsal bone, and the action is the prime mover of the dorsiflexion. Next is the extensor digitorum longus, which is 34. The origin is the lateral condyle of the tibia, 3/4 of the fibula, and the insertion is the middle and distal phalanges of the second to fifth toes, and the action is the prime mover of toe extension. Next is the fibularis tertius, and the origin is the fibula and interosseous membrane. The insertion is the fifth metatarsal. The action is the dorsalflexes and everts the foot.
So it's right there in the book, right here.
Okay, next is the extensor hallucis longus. So it's 44. It's like connected to 34 down here. The origin is the anteromedial fibula shaft, and the insertion is the distal phalanx of the great toe. The action is it extends the great toe. Okay, next is the fibularis longus. The origin is the head / upper portion of the fibula, and the insertion is the first metatarsal and media cuneiform. The action is the plantar flexes and everts the foot.
So it'd be right there.
Next is the fibularis brevis. The origin is the distal fibular shaft, and the insertion is the proximal end of the fifth metatarsal. The action is it plantar flexes and everts the foot.
So it'd be right there.
Okay, next is the triceps surae. This consists of the gastrocnemius and the soleus.
It refers to muscle pair that shapes the posterior calf and inserts via a common tendon into the calcaneus of the heel.
So the gastrocnemius so it's 37 and 38. So this is 37. And then 38 is right here. Its origin is the medial and lateral condyles of the femur, and the insertion is the posterior calcaneus via calcaneal tendon, and its action is it plantar flexes the foot. Next we have the soleus. So soleus is 39. So that is right here. Its origin is the superior tibia, fibula, and interosseous membrane. The insertion is the posterior calcaneus via calcaneal tendon, and its action is it plantar flexes the foot. So next is the plantarius. The origin is the posterior femur above the lateral condyle, and the insertion is into the calcaneus or its tendon. Its action is it helps to flex the leg and plantar flex the foot. So, as you can see in the book, should be, we can just show them on this. So you can see it on the Quizlet where it's at.
Right there.
Okay. So next is the popliteus, which is 41, under 37 and 38. So 41, which is it's supposed to wrap around. I think it's like up here, but I don't think it's labeled. It's like around here. The origin is the lateral condyle of the femur and lateral meniscus of the knee. The insertion is the proximal tibia, and its action is it flexes and rotates the leg medially to unlock extended knee when flexion begins. So then next is the flexor digitorum longus, which is 42. Oh, it's up here. 42. The origin is the extensive origin on the posterior tibia. The insertion is the distal phalanges of the second to fifth toe, and the action is the plantar flexes and inverts the foot and flexes the toes. Next is the flexor hallucis longus, which is 43. So that one is here. The origin is the midshaft of the fibula. The insertion is the distal phalanx of the great toe, and the action is it plantar flexes and inverts the foot. It flexes the great toe at all joints. So next we have the tibialis posterior, which is 40. So that's right here, and it continues down here. Its origin is the superior tibia and fibula, and the insertion is the tarsals and metatarsals 2 through 5. The action is it's the prime mover of foot inversion. So next is the extensor digitorum brevis, which is 46. I have to get up for this one. So 46 is actually like right here, and it comes right here. The origin is the calcaneus bone, and the insertion is the proximal phalanx of the great toe, and the action is it helps extend the toes at the metatarsophalangeal joints. Next is the flexor digitorum brevis. The origin is the calcaneal tuberosity, and the insertion is the middle phalanx of 2 through 4th toes. The action is it helps flex the toes. So as you can see in the book,
Is right there.
next is the abductor hallucis. So that is 48. So that's going to be in here. Right here. Okay. The origin is the calcaneal tuberosity and flexor retinaculum. The insertion is the proximal phalanx of the great toe, and the action is it abducts the great toe. We have the abductor digiti minimus, which is 47. Right here. The origin is the calcaneal tuberosity, and the insertion is the lateral side of the little toe's proximal phalanx, and the action is it abducts and flexes the little toe. So next we have the flexor accessoris. The origin is the medial and lateral sides of the calcaneus, and the insertion is the tendon of the flexor digitorum longus and midsole, and the action is it abducts and flexes the little toe.
So it'd be right here.
Next is the lumbricals. The origin is the flexor digitorum longus, and the insertion is the proximal phalanx of toe 2 through 5th. And the action is it flexes toes at the metatarsophalangeal joints and extends the toes at the interphalangeal joints.
So it'd be right here.
Next is the adductor hallucis. The origin is the bases of metatarsals 2 through 5 and the fibularis longus tendon sheath. The insertion is the proximal phalanx of the great toe, and the action is it helps maintain the transverse arch of the foot. Next is the flexor digiti minimi brevis. The origin is the base of metatarsal 5. The insertion is the proximal phalanx of the 5th toe, and the action is it flexes the little toe at the metatarsophalangeal joint.
Right there.
So next we have the plantar and dorsal interossei. They're two separate things, but they kind of correspond with each other. So they're similar to the palmar dorsi interossei of the hand in the locations and the attachments and actions. However, the long axis of the foot around which these muscles orient is the second digit, not the third. So if you can't remember what these are for like in your hand, just go back through the video and rewatch for the palmar ones.